There's a lot of things that scare people out in the woods. Bears, I think they're kind of cool. Any encounter I've had with a bear, and I have had a mock charge on me, they've run off. The mock charge got my heart pumping. Wolves or coyotes, you hear them howling in the woods. To me, that just sounds like, wilderness. Snakes. I think snakes are cool. They don't bother me at all. What really bugs me are ticks. They are the creepiest things to me. And I wanted to cover some of the tick-borne illnesses that you can get and why you need to be really careful. There are 7 ticks in the United States that the Center for Disease Control says are of interest to people because they can infect you with diseases. Of those 7, there are 2 that carry the most prevalent diseases. The black-legged tick and the American dog tick. In the last year, I could track down from the CDC of a listing of reported illnesses from tick-borne diseases. You had the first on a list of Lyme disease, 34,945. Next down, you had anaplasmosis, 7,976. Next is Rocky Mountain spotted fever, which they changed the name to, and I have to look at my note here because it's a weird one. Spotted fever Rickettsiosis. Rocky Mountain spotted fever. Those you had 5,207 illnesses, 5,207. Then you have Babesiosis, 2,420. Tularemia, which 274, so the number is getting quite small. And then Powassan Virus, and a virus you can't treat effectively. 43 cases. Okay, the most important one to think about here is Lyme disease, with obviously 30,000 plus cases in 2019. This has gotten to a lot of people. You can see the region here where the black-legged tick inhabits in the United States. So there's a lot of people who have the possibility of being exposed. The symptoms can appear anywhere from 3 to 30 days after being bitten. And the hallmark of Lyme disease that everyone talks about is the rash that you get that looks like a bullseye. This appears in 70 to 80% of the people who are infected. For those who do not develop the rash, they can get fever, chills, headaches, fatigue, muscle and joint aches. Swollen lymph nodes all may occur in absence of a rash. I would assume you could probably get all those symptomology with the rash also appearing. Untreated, Lyme disease can cause a wide range of symptoms, including fever, rash, facial paralysis, which is also called Bell's palsy, where you kind of mimics a stroke almost, and arthritis. And the arthritis can affect the large joints, like the knee joints, and it is devastating and very debilitating for people who have not been treated or are treated and for some reason the illness is resistant to whatever treatment they have. So if you are in an area where there are ticks, or you've been bit by a tick, and you show any of these symptoms, get to a doctor for treatment. There are treatments available. Antibiotics are administered, and it's your best defense. So, and I'm going to say that in every one of these diseases that I've covered here. Best defense is to get to the doctor. They can be treated. Next on the list is Anaplasmosis. It is a bacteria also, from the black-legged tick. The signs and symptoms begin usually in 1 to 2 weeks after an infected tick bites you. The problem is, of course, as we all know, tick bites are painless. So again, be aware of whether you've been in a tick area and always do your tick check to make sure you don't have a tick on your body. You can end up with early signs of our fever and chills, severe headache, muscle aches, nausea, vomiting, diarrhea, and lack of appetite. It can be treated. If treatment is delayed and there are other medical symptoms present, it can kill you. You can end up with respiratory failure, bleeding problems, organ failure, and the ever unpopular death. So, if you have symptoms after being bit by a tick, get to the doctor. The third most prevalent disease passed by ticks, and this comes from the American dog tick, is Rocky Mountain spotted fever, which they now call, let me look at my list here, spotted fever, Rickettsiosis. I think I said that wrong, but Rocky Mountain spotted fever. Signs and symptoms can be fever, headache, rash, the Rocky Mountain spotted fever rash, nausea, vomiting, stomach pain, muscle pain, lack of appetite. Again, people usually develop the rash after 2 to 4 days. I'm sure that, like with Lyme's, not everyone gets the same kind of rash. Apparently some of the rashes can be, red splotchy, and some can just be pinpoints of red pinpoints. But you will probably get some sort of rash. It usually develops along with the fever. Rocky Mountain spotted fever can cause permanent damage. It can damage your kidneys. It can damage blood vessels. Some people who recover from it, well, I'm reading this from the CDC, can be left with permanent damage, including amputation of arms, legs, fingers, or toes from the damaged blood vessels, hearing loss, paralysis, or mental disability. Any permanent damage is caused by the acute illness initially caused by the disease, not an ongoing thing. So getting treatment is absolutely essential. Again, that was from the American dog tick, which has a pretty wide range in our nation also where it inhabits. The next one is Babesiosis, with 2,420 illnesses reported in 2019 caused by that. It is a parasite that attacks your red blood cells. Normally, most people show no symptoms. If we're infected, if humans are infected, we're the end of the line for a parasite. It dies off in us, not a problem. For those who are infected and have a problem, of course, it always goes back to the same thing here of those with compromised immune systems, the very young, the very old, people with AIDS are being treated for cancer who have had their immune systems knocked down as part of their treatment. Or those who do not have a spleen, which I have not researched enough to understand why, but if those who do not have a spleen. The complications from Babesiosis, for those who actually end up with a issue, again, those who have weak immune systems, don't have a spleen, the very young, the very old, you end up with low or unstable blood pressure. Again, this is attacking red blood cells. Severe hemolytic anemia, very low platelet counts, thrombocytopenia, disseminated intravascular coagulation, which sounds really hideous to me, which can lead to blood clots, obviously, coagulation, clotting, kidneys, lung, and liver damage. In short, untreated, for those who become ill from it, it can kill. So it's imperative getting medical treatment. The last one I want to do, and this is not very prevalent at all, 43 cases, is Powassan Virus, but I'm doing it because it is a virus. And you can end up with it and show no symptoms, like a lot of the viruses in this world that people get, they show no symptoms from it. Only very few people become ill with it. But it can cause encephalitis, which is a swelling of the brain, or a swelling of the sheath around the spinal cord and the brain, the meningia, that can cause meningitis. And 10% fatality rate in people who really get infected badly and show a very adverse reaction to the virus. There's no specific treatment. We don't have a lot of antiviral drugs in our medicine cabinet in this world. They do supportive treatment. If the person has respiratory issues, they support the respiration. It goes on and on and on and on. But treatment is necessary. You got to get to a doctor. Initial symptoms: fever, headache, vomiting, weakness. As it goes on, it's like encephalitis, where people become confused, difficulty in coordination, can't speak, seizures, all the type of things of a neurological pathology that would be caused by this. So, the point being is, if you start showing symptoms, fever, headache, vomiting, weakness, and you've been bit by a tick, does no harm to go to the doctor and get checked out. Again, only 43 cases of it in the U.S. in 2019, but it's worth knowing about. Okay, now that I've talked about what diseases you can get from ticks and which ticks give them to you, what can you do to prevent being bit? Well, number one, when you're hiking, stay in the center of trails. I know that's not often possible. I do a lot of bushwhacking where I just head off. So you have to be careful about that. Do tick checks every day when you get in. I always do when I'm out backpacking or camping. I always check. My wife used to make fun of me when I'd get home from a trip. And I'd walk in the bedroom, say, honey, come here. And I'd take my clothes off and turn around and say, did I miss any on my back, my butt, the back of my legs? Okay? I was always paranoid about ticks. I've never had one attach. But I've always been paranoid, and maybe that's why, because I'm so careful about it. My wife, like I say, used to laugh at me. She's an environmental educator. She's out on the trails all the time teaching classes with kids and that. She's a tick magnet. She has brought more ticks home. Now her procedure is this. Ticks die if they are dehydrated, if they are emaciated. That's why humid, hot weather, they love it. Dry weather, drought areas and that, you don't have as many ticks. She comes home, walks by, goes to the laundry area, takes her outer clothes off, her pants, her shirts, socks, throws them in the dryer, and runs them in the dryer. That will kill them all, because laundering them may not necessarily do it. Then she washes her clothes. So she runs them for about 20 minutes, gets them good and hot and dry, and any little devils in there that are just like toast. The other thing that can be done is to treat your clothing, only your clothing, with permethrin. It is an insecticide. It's the same one they use for headlice. So I bought the one from Sawyer. I bought it from Amazon. I'll put the link. It's like $16 for 24 ounces pump spray. We treated my wife's boots, her pants. She didn't want me to do her shirts, but we got her pants and her boots treated, and a couple pairs of socks. You spray them down, you follow directions, you spray them down until you can tell they're wet. They don't have to be soaking, but just wet. And again, you follow the directions. Then you hang them outside to let them dry. There are some people who will spray them down and throw them into like a big trash bag and tie them up and let them sit overnight, and then take them out and air them out and let them dry. It's a pesticide. It also will keep the bugs off. I have no idea how it repels them, but apparently it does. I have a boonie hat from Colombia that had a treatment on it, and it keeps bugs away from my face to a certain extent. This treatment will last multiple washes, but we retreat periodically on my wife's clothing, on the stuff I wear in the backcountry. It will keep them off. If the little suckers do get on you and they start really encountering the compound, it is an insecticide and they die. So it's a good idea to try to do that. Again, permethrin, I got it. It's Sawyer product. I saw somebody online buying it concentrated and diluting it because it was cheaper. Unless you're treating a tremendous amount of clothing. I don't know why you would need to go that much cheaper. And there are some additives that companies put in for the ones you spray on clothing that help it penetrate, permeate the fibers, and adhere better. So I'll just spend the extra money, get one that's meant for treating clothing. I do not recommend buying the concentrate. I'm sure other people would have no problem with it. That's just me. But again, do your tick checks. Use insect repellent. Treat your clothing. Whenever possible, kind of try to avoid tick area. When it comes to tick checks, check everywhere. They like to get in your groin. They want warm, moist areas. I've heard them crawling into an ear, which is so disgusting to me. Attaching to the scalp. My brother-in-law has had that happen a couple times because he runs his one dog in a field. So check everywhere you can. Have somebody help check if necessary. Like I said, like I do when I get home. Tell my wife, do I got anything on my back? I do the same thing with her. You know, you look out for that mole that was never there before type thing. But that's what you need to do. And most of all, if you have illness after getting bit by a tick or being in an area of ticks, seek medical treatment. It can't hurt to go to the doctor and then to say, oh, it's nothing. If you suspect it is something and you get a doctor who says, oh, it's probably a bug bite. Oh, you probably have the flu. Push it. Go to a different doctor if you have to, because these are not illnesses that you want to play with. You're responsible for your own health care, ultimately. And doctors are busy. They can make mistakes. They're human. I hope you enjoyed this video. I hope it offered some information. I'm going to put links in the description to a very good pamphlet put out by the CDC that shows the illnesses, shows the ticks, the regions they're in, and the treatment protocols. It's well worth it. So check that out. Check that link out. You can download it. It's a PDF. Very well worth it. Again, it shows you exactly what medications are recommended for treating the specific diseases. So check it out. As usual, if you liked this, do me a favor, subscribe. Share this if you could. But most of all, get outdoors, have some fun, and be safe. Thanks.